Hello and welcome to the COMLEX Instant Review. Let's talk about pulmonary hypertension. What is the normal pulmonary artery pressure? The answer here is it's between 10 to 14 mmHg. And so by definition, if the hypertension is greater than 25, then that's considered to be pulmonary hypertension. If the patient is exercising, then what is considered to be pulmonary hypertension? The answer here is going to be 35. So remember the values: 10 to 14 normal, 25 or above is going to be pulmonary hypertension, and if the patient is exercising, then 35 or above is going to be considered to be pulmonary artery hypertension. Now, what are some of the complications that can develop in patients who present with pulmonary hypertension? Certainly atherosclerosis, medial pulmonary hypertrophy, and also intimal fibrosis of the pulmonary arteries. So there's two types, and what is the difference between primary and secondary? What actually causes primary pulmonary hypertension? Well, primary pulmonary hypertension is because of the inactivation of the mutation in the BMPR2 gene, which normally functions to actually inhibit vascular smooth muscle proliferation. Whereas with secondary, patients usually have another pathology like mitral stenosis, COPD, recombinant thromboembolies. Patients can have systemic sclerosis, some sort of a fibrosis causing hypertrophy. Also, left to right shunts are very common in patients with pulmonary artery hypertension. And so let's review each of the causes. If the patient has COPD, then there's going to be destruction of the lung parenchyma, and that's going to cause the hypertension. If you have mitral stenosis, the mitral valve is stenotic, there's increased resistance and increased pressure, and so there's going to be backward flow. If there is thromboemboli, then you have a cross-sectional area of the pulmonary vasculature that's going to be blocked, and that's going to lead to hypertension buildup. With patients who present with any sort of a fibrosis or an autoimmune condition, well, there is fibrosis causing hypertrophy, and as a result of that, there's going to be hypertension. With the shunts that go from the left side of the heart to right side to bring more blood to the pulmonary vasculature, in these cases, there's going to be endothelial injury because of the increased shear stress that's present. And with patients who are obese and have signs of sleep apnea, the key thing is going to be hypoxic vasoconstriction. Keep in mind that severe respiratory distress can lead to right ventricular hypertrophy and eventual death from cor pulmonale. So those were some of the high yield points in terms of pathophysiology and the definition of pulmonary hypertension for the COMLEX and USMLE board exam. Please visit comlexflashcards.com for additional board review lectures, and good luck in your preparation for the boards.